Okay, it looks like everyone's in, so we'll start now. First, I wanted to thank you on behalf of the National Treatment Quality Initiative teams and my team and my colleagues on the line for joining this webinar and our overview of the 2021 Atlas Survey Public Comment Period. We appreciate your time today, and we look forward to walking through these items with you. My name is Shannon Biello. I am the Director of National Treatment Quality Initiative. And again, just grateful and appreciate your time in joining the webinar. So we'll start now. So very quickly, just walking through the structure and content of this webinar with you all. I'll first provide an overview of Shatterproof and Atlas, our quality measurement platform for addiction treatment facilities. I'll then discuss Atlas progress to date, and following that, I'll focus on proposed changes to the Atlas data collection process and the treatment facility survey for 2021, and end with information on how you can participate in the 2021 public comment period. I'll note quickly that our public comment period has officially commenced, very exciting, and we encourage you all to submit your feedback via the link provided on this slide. All comments are due by 5 p.m. on Tuesday, March 16th. And of course, if you have any questions, please feel free to email us at atlas@shatterproof.org, linked on the slide. And we'll revisit how to participate in the public comment period again at the end of this presentation, just as a refresher before we sign off. I'll also quickly note that the 2021 treatment facility survey will be released to treatment facilities prior to data collection in around April 2021. For those of you who may not be as familiar with our work, Shatterproof is a national nonprofit dedicated to reversing the addiction crisis in the U.S. And to that end, we focus our work within 3 pillars listed here. Atlas, our quality measurement system, falls into our efforts to revolutionize the addiction treatment system. Our work in revolutionizing the addiction treatment system spans multiple domains. You'll see them listed here. And what we'll focus on today with Atlas is that quality measurement, blue pedaler arm as a diagram. Briefly, and as many of you know, part of our efforts to transform the addiction treatment system began with our work to standardize clear quality expectations for addiction treatment through the Shatterproof National Principles of Care listed here. The Shatterproof National Principles of Care are the key elements of high-quality addiction treatment shown to improve the health of people with addiction. These core components were identified by a task force composed of experts, medical professionals, and policymakers, and are derived from the Surgeon General's landmark report back in 2016. The Atlas Quality Measurement System is designed to take the next step in implementing and measuring progress towards these quality standards. This free resource brings transparency to the addiction treatment field by providing information on how well addiction treatment facilities offering services and processes align with clinical best practices outlined in the Principles of Care. And this information is displayed publicly on the Atlas website in facility profiles. Unlike existing treatment locators, Atlas is not a pay-to-play system. It's a comprehensive resource. We list all addiction treatment facilities in the state and offer them an opportunity to submit data to us. In addition to the first transparent set of quality data on addiction treatment facilities, Atlas also includes the addiction treatment needs assessment to ensure people know what kind of treatment to look for based upon their needs. You'll see that Take Assessment button right there on the homepage. And then Shatterproof has worked with key stakeholders across this whole implementation process, including individuals with substance use disorder and their families, to ensure that we've created a platform that provides an optimal user experience and meets the needs of our target audiences. So a lot of input from stakeholders and something that we're continuing to work on here with the public comment period. Very quickly as well, Atlas Phase 1 was a $5 million pilot. It was funded by Arnold Ventures, the Robert Wood Johnson Foundation, and a coalition of health plans. Our first phase, as many of you know, is implemented in 6 states. That's Delaware, Louisiana, Massachusetts, North Carolina, New York, and West Virginia, in partnership with our state agency or INCA organization. And we've used throughout this implementation process a state-based approach to engage key stakeholders from various sectors in Atlas development and implementation. And the public comment period serves as another opportunity for us to gather feedback from key partners in this work and other interested groups. So we're very appreciative of your time today and your participation. The platform launched on July 21st, 2020. So quickly looking at our upcoming priorities, currently our team is working to sustain Atlas in the phase 1 states while raising awareness about this resource, both within those states and nationally. We're also working with stakeholders on how to use Atlas data to support quality improvement efforts. I think a most recent example of this is our addiction treatment continuous quality improvement webinar series. We're also excited about upcoming work in 2021, which includes expanding Atlas to additional states and moving forward with our Atlas Claims Planning Grant, which will use lessons learned from piloting the claims measures in phase 1 to identify efficient and effective approaches for calculating and displaying claims measures in 2022 and beyond. I'm happy to provide any additional information as people are interested in that effort as well. As we think about Atlas priorities in 2021 and beyond, our team will of course remain focused on revisiting and revising the Atlas quality measures to ensure they're reflective of current best practices in addiction treatment. And please reach out if you have any questions related to these or any of the items discussed on this slide. Related to the measures, I wanted to briefly talk also about our data sources. We developed, tested, and implemented a standardized set of healthcare quality measures for addiction treatment facilities. The measures are designed to examine whether addiction treatment facilities are delivering care in accordance with the principles of care using multiple validated data sources. Sorry about that. In 2021, Shatterproof will again collect data using the Treatment Facility Survey, which is an online survey administered at the facility level that assesses processes, structures, and services at the addiction treatment facility. And we'll be gathering feedback on this data source during this public comment period. Additionally, we'll also collect data via the Patient Experience Survey, which is a series of multiple choice questions about the use of clinical best practices and perceptions of care, and one open-ended question on experience of care at the facility to be completed by patients or loved ones acting as a patient proxy. As mentioned too, we're implementing a claims planning grant to continue to look at and assess the claims measures as part of the Atlas project as well. Now we'll jump into our proposed survey enhancements. Again, in this public comment period, we're focusing on data collection in the treatment facility survey specifically. These proposed changes I will flag for you are outlined in more detail in the supporting documents we sent out on Tuesday via the atlas@shatterproof.org email. If you did not receive that email, please reach out to us at atlas@shatterproof.org, and we're more than happy to provide you with those documents. These documents are also available and linked in the survey. So if you go to the survey link and you read the top introduction section, you can also access those descriptive documents there. And we encourage you to look through them and provide your comments based upon the information we display there and discuss on this webinar. I want to also flag that the proposed changes discussed in this section were recommended by subject matter experts and Atlas stakeholders. These changes are not finalized and therefore may not all be included in the upcoming data collection process, but we wanted to lay out and show and open for feedback the changes that we're thinking through for the Atlas project as this initiative evolves. So quick flag there. I'll start by reviewing our goals for enhancement. These are 5 key goals that we've identified as priorities as we think through how to enhance the Atlas project moving forward, and specifically data collection and the treatment facility survey. You'll see one is expanding the provider types listed within Atlas. We'll discuss that in an upcoming slide. Also, and of course, something we're thinking through is how do we reduce provider burden? And this is in response to feedback that we received from our providers following the phase 1 data collection period, and again, making sure that we're responsive to our stakeholders as we continue to implement this initiative. We're also thinking through how we add additional information to better meet patient needs, how we can streamline the survey process for for those providers with multiple sites. We know that some people oversee multiple sites and are responsible for completing the survey for those multiple locations. So how do we streamline the survey process for them? And finally, thinking through how we add information, data, and items to our data collection processes that better meet patient needs, but also explore potential new addiction treatment processes and procedures that have been evolving in this space in the past year or so. So continuing to, as mentioned in the priority slide, evolve the measures to work and align with advances in the addiction treatment field. Importantly, we'll also flag what will remain the same from phase 1 data collection in 2021. So these are things that worked and that we're planning on continuing to implement in the next data collection period. So first, facilities will receive a reference copy of the survey prior to the start of data collection. Make sure that can look through the items and prep for submitting data to Atlas. Again, we expect to send out this reference copy in early April, so be on the lookout for that email. Similar to last year, we're also going to offer a help desk throughout the data collection period as facilities work to complete the treatment facility survey so that we can address any technical or content issues as they arise and be supportive as the providers complete the survey. We'll also continue to work with treatment facilities on how to collect patient feedback and maximize these data for quality improvement efforts. That's another important piece of this platform and one that we want to continue to support providers in. And finally, we'll host a provider preview period similar to last year to allow facilities to review data in their facility profiles prior to release of this information on the Atlas platform. So more information about this will be sent out in the future. So again, be on the lookout for that. But note, similar to last year, that the provider preview period is intended to address any potential issues in data import so that the information you submitted to us is accurately reflected in your facility profile. With this, we will talk first about proposed changes to the Atlas data collection. So Shatterproof received important feedback from our key stakeholder groups on how to improve our processes moving forward. And these are key enhancements that we've identified and proposed for 2021 and welcome your feedback on. So first, Atlas primarily collected data from specialty addiction treatment facilities, which we define as physical sites offering withdrawal management or addiction treatment or services that focus on initiating and maintaining an individual's recovery from substance misuse and preventing relapse. For our sample definition, defining which facilities we would collect data from in phase 1. In 2021, Shatterproof proposes expanding the scope of Atlas data collection to include office-based providers, mobile treatment providers, and digital health app-based or exclusively telehealth providers. So making sure that we're capturing all different types of providers who provide addiction treatment services to patients. Additionally, we're also proposing pre-populating the treatment facility survey for those facilities that completed the treatment facility survey in phase 1. So rather than requiring that they enter their responses to all questions again, we will plan to pre-populate their 2021 survey with their data from 2020 for ease of submission. Of course, facilities will be able to update any pre-populated responses if their services have changed. It's just a way of allowing them to review and check if the information is correct, adjust as needed, and submit to really facilitate the submission process. We also plan on improving the survey attestation process, and that is the end of the survey where we require facility senior leadership to review and attest or confirm the accuracy of survey responses. We plan to increase the navigability of the online treatment facility survey because we heard from stakeholders that it was difficult to respond to questions and then have senior leadership review them again, get back to the beginning of the survey to review responses. So that's something that we have top of mind as we head into our next data collection period. And finally, Shatterproof is also working to enhance our multi-step validation processes for 2021. And this, we are proposing adding additional embedded survey logic and validation to ensure the accuracy of responses during actual survey completion, using additional external data sources to validate information submitted through the survey, and thinking through ways we can add options for validation of survey responses via video conferencing with facility staff. Again, there's supporting documentation that outlines all of these changes, and we look forward to your feedback on how we plan to or propose adjusting the data collection protocol, as well as any other considerations related to Atlas data collection processes that you may be thinking about as we head and prepare for the next data collection period. Moving on to the treatment facility survey, our TFS, our acronym, just so you know. As mentioned previously, in 2021, Shatterproof will again collect data from addiction treatment providers via the treatment facility survey. And the Atlas treatment facility, again, is administered online. And in order to simplify the survey, we're proposing the following changes for comment. Previously, we offer the option to complete certain sections of the survey at the facility level, or if a facility offers multiple levels of care, for example, outpatient and residential, they could respond for each of these different levels. Since in phase 1, very few facilities elected to complete the survey sections by level of care, we're proposing retiring this option in an effort to simplify and streamline data collection. When possible, another thing we're proposing is pre-populating the level of care variable with available state data. This change will not impact the survey item itself. Rather, it involves Shatterproof working with state partners on the back end to complete this pre-population and ensure that our data align. Additionally, in response to high burden and other issues around the reporting of FTE or full-time equivalent hours, Shatterproof is proposing a revision to the survey questions so it's easier for facilities to complete. And we provide that revision in the supporting documentation, so please take a look. And we also welcome any comments from our stakeholders and the public about how to improve the collection of FTE data moving forward. Additional changes to the treatment facility survey involve additions. So looking at what we want to add to the survey. So we're proposing some new items and response options to the treatment facility survey. On this page, we specifically focus on the new response options we want to add. So first, when asking about standardized assessment instruments used for intake evaluation, Shatterproof proposes the inclusion of additional response items to reflect assessments used widely across existing and new states. So we'll add these based upon conversations we have with new and existing states prior to data collection. When asking about private insurance accepted by facilities, Shatterproof is proposing expanding the list of private insurance options listed to include all plans available within a state, really drilling down and having more granularity there with data collection. And finally, when asking about special groups served in the survey, Shatterproof proposes expanding the list of special groups to include those individuals with intellectual disabilities. So collecting data on which facilities offer special programs for individuals with intellectual disabilities. And again, these changes are shown in greater detail in our supporting documentation. Continuing onward with some more additions, these are whole new survey items. So after conversations with stakeholders and experts, Shatterproof proposes including new survey items that address the following. One is COVID-19 impacts to facilities. Another is digital or telehealth options available through facilities. Of course, any new accreditations, certifications, or designations that have arisen in the time that we last collected data to now, so acknowledging those new accreditation, certifications, designations, asking about patient-centered care practices, and looking at the collection of patient social determinants of health information. Additionally, we wanted to flag some other things that we're looking about, discussing, and exploring as we prep for more data collection. So one is we'll be looking at if new behavioral health therapies meet the minimum level of rigor for inclusion in the treatment facility survey. As a reminder, we require for behavioral therapies that we list in the survey and collect data on, we require efficacy demonstrated in treating the substance use disorder from at least 2 independent randomized controlled trials and a large-scale real-world field trial. So seeing if any of behavioral therapies have met that level of rigor so we can add them to the survey. And we're also looking at the ways in which we can ask about include questions that address stigma and additional questions that look at care coordination among providers, as well as participation in collaborative care models. And again, this is all detailed in our document, so take a look. And again, looking forward to your additional comments and feedback on these proposed changes. Finally, we wanted to highlight 2 changes that we are proposing to the patient experience survey very quickly. One is looking at increasing clarity around the open text responses for patients and families. Those data are displayed on the Atlas website, so making sure that people know that it's displayed as narrative feedback and we're asking a question that facilitates narrative responses to display on the site. And then looking at offering the patient experience survey in Spanish. So as I mentioned at the beginning of this webinar, the Atlas 2020 survey public comment period is now open, very exciting. We've already received some responses, so that's fantastic. We look forward to even more responses as the public comment period continues. Again, you should have received an email with the supporting documents and information on how to submit feedback via our survey on Tuesday. And if you didn't, please just email us and we'll make sure you have all the information you need. And if you didn't, again, I'll mention that you can visit the link included on the slide, which is our survey, where we will be collecting feedback. And the survey includes links to the supporting documents. So once you're able to review the supporting documents, you will also have the opportunity to either write out your comments in the text box or submit a document of your comments to us via that survey link. So again, looking forward to your comments. All feedback is due by Tuesday, March 16th at 5 p.m. And following the close of the public comment period, Shatterproof will review all feedback and share externally in a summary document. So be on the lookout for that as well. If you have any questions or any issues, any technical problems accessing either the supporting documents or the survey, please reach out to us. We want to make sure that your voice is heard in this process and that you're able to submit your comments. So we're more than happy to work through with you any technical issues or access issues you're experiencing as the public comment period is opened. So we'll look for your email. And then finally, we'll just close and say we appreciate your time spending time with us on this call to review our proposed changes and to hear about Atlas and what we're thinking about for 2021 in terms of data collection in the treatment facility survey. And we look forward to your feedback and your continued support in increasing transparency and driving continuous quality improvement in the addiction treatment space. So thank you very much. And please email us if you have any comments or questions.
Thank you all so much. And yes, we will be sending out this deck via email as well as the recording for those who want to review it or weren't able to attend. I will say that during this, we're not accepting any comments verbally or via the chat right now. We ask that you submit those via email or via the survey that we included the link to in the slides. But if you have any technical questions, so logistical questions about how to access the survey, please feel free to ask those right now. But again, we won't be taking any any public comments via the chat at this time. We ask that you please submit those to Atlas at Shatterproof or via the survey, which actually, Shannon, would you be able to post the survey link in the chat? And you can stop sharing your screen right now. Thank you. Sorry.
Yes, and we'll, as Carolyn mentioned, we'll leave the line open for a couple of minutes in case people have any technical issues with the survey or they have any questions about the process for submitting public comments. And we're happy to assist. I will be posting the survey link in one moment.
And yes, if you have any technical questions, oh yes, sorry, it was a private message to me. We are available. We're happy to coordinate offline if you have, like, for instance, a large group and you want us to answer any technical questions for the large group. You want us to walk your group through what the changes to the survey and data collection are. We're more than happy to do that. Thank you, Ashley.
And here is the link, everyone. I'm going to say, Carolyn, it doesn't seem like we're getting any additional questions, so I think we're good to close. Again, I will say we're so thrilled that you all joined. It's always great to present to you all and talk about the direction the project is going. And again, you have the survey link. If you encounter any issues, reach out to us, but we're really looking forward to your feedback. So thank you so much.
Thank you all. We hope you have a great rest of your day.